All right, everyone. It is 10 o'clock, so I will go ahead and get us started. Good morning. I am Taylor Post, Swiftland's office manager, and I would like to welcome you all to today's webinar, Coronavirus, Hoaxes, Fear, and the Truth, How Libraries Can Help, and today's presenter, Dr. Stephanie Rollins. Dr. Stephanie Rollins is a research and writing specialist at the Air University Press at Maxwell Air Force Base. She is also an adjunct professor for the University of Alabama and teaches digital reference, collection development, and organization of information, among other courses. Stephanie serves on both regional and state library committees, and she has 23 years of experience in academic and special libraries. She holds a BA in English from Auburn University, a master's degree in library service, and a doctorate in public administration, both from the University of Alabama. Please welcome Stephanie and enjoy her webinar this morning. Dr.
Thank you so much, Taylor. Can everybody hear me okay? Fantastic. How's everybody doing today? I just want to take a moment to check in on you and see how you're doing because if you're like me, there's a little bit of stress going on. A confession to make. I was laying in bed last Saturday and thinking about this, about coronavirus, COVID-19. You know, the terms are interchangeable. And I just wanted to do something that I could think about that would help libraries, that would help people in Florida, because I had the closest relationship with you guys with teaching and everything. And what could I put together that would save you some time? What are the facts? You know, how can we, in times of crises, look at these facts and make sure they're real? Because there are a lot of hoaxes out there. You know, how can we discern the information is true and correct? And what can we help our patrons do in this time when libraries are closed? We're trying to figure out how to help them. And so I wanted to put something together that would help. That's what I do in times of crisis. I like to try to help people. And so today what we're going to do is we're going to look at some information on coronavirus. And I just want to, as we go through it, as you have questions, please put them in the chat box. I will try to answer them. Again, I'm not a medical doctor, as my son would joke. Mom, you have no patience. But I am an information professional, and we all have the skills to discern which information is correct and which information isn't. But as you have questions, please type them in the chat box. If we need to stay longer for me to try to answer them, I will. Or I will get back to you via email if I don't know the answer. And I'm also not a psychologist. What I'm going to talk to you today about coping is just me talking and some information that I found that might help you, might help your patrons, might help your family try to get through this. So that's the goal for today. That's the summary. The actual agenda is here. So we're going to look at what is the coronavirus, just a very brief review to make sure everybody's on the same page. What hoaxes exist, how can you get help determining. There's some automated methods, but also, you know, why should we focus on this and why should it be us? You know, libraries have a great opportunity in this time of crisis. You know, people have always gone to libraries, you know, when they haven't had jobs or they're trying to learn. And so why should this time be any different? We can definitely help our patrons despite being closed. And so we'll get into that a little bit later. Some basic information about verification and fact checking, you know, just some basic terminology. So how can we, you know, we've got these great automated methods, but we also need to think about what can we do when we don't have those automated methods? What techniques can we use to verify the information is correct? How can you prepare if you haven't already prepared? How can you get more help? What sites can you do that with? And how can you market your services? People are putting a lot of information out there about coronavirus, but I don't see a ton of people still offering library services. And I've got some great examples from Florida, different libraries that I want to show you that I think have done a fantastic job. But we still want to make sure that we can reach them and they can get the help that they need, whether they come to our library or not. Just like in normal times, we want to make sure that we can do that. And then what are some trusted resources? We're going to cover this kind of throughout the entire presentation. what sources can we send our patrons to for more information? So let's go ahead and get started. So my go-to is the CDC for information. And this just talks about a basic overview. This handout you can download, you can post it on your Facebook for your library, you can share it with your family and friends, but it's just a very simple overview of what COVID-19 is. And actually, the coronavirus is not new. Coronavirus is actually a group of viruses. I didn't know this until a couple weeks ago that it was actually several different viruses. We've had it before. SARS is kind of a form of it. And it's called corona because when you look at it under a microscope, it looks like a crown. And there's, it's a respiratory illness. It's the thing about this that's it's new. They haven't seen it before. They did discover that it was new, and that it's super spreads very fast, and that's kind of the scariest part about this virus. Um, and it can be overwhelming, and I'm going to talk about some ways that you can make it not so overwhelming for you as a person, for your libraries, and different things like that. And so it spreads by, between people in close contact. It's a, or you touch a surface. And some of the symptoms, of course, you guys probably all know this, but is fever, cough, shortness of breath, and sometimes people end up with both lungs, and of course, people are dying, which is very bad. However, there are some things that you can do. We're going to talk about that. And then for me, what's kind of hard is that this time of year, especially in Alabama, and in Florida too, I'm sure, is we've got a ton of pollen. So, do you have allergies? We also have the flu virus going on, and then the coronavirus. So, these are some of the symptoms of all three of them. With coronavirus, it appears 2 to 14 days after exposure. So it's kind of hard to tell what you have. And the advice I have seen is call your doctor. Don't just show up at your doctor's office. Call them, and they can kind of triage what symptoms you have and see if you need to get tested. Yes, Nevin, we are going to provide transcripts of this. I can also send you the PowerPoint if you'd like, but you will get copies after the session, and it is being recorded. There's not currently a vaccine. I know that they're working on some things, and there's not really a treatment. So that's just a little bit about the coronavirus. And I found this, I mean, there's tons of information out there. So today I'm not providing everything under the sun. I'm trying to provide just a limited amount of sites that you can go to because, again, too many sites can be overwhelming. But I really like this video. It's 4 minutes, and she goes into what coronavirus is, COVID-19. She's very calm. She doesn't use medical jargon. And it's also from Johns Hopkins University, which is one of the sites I trust. They're actually putting out a ton of data on the statistics for coronavirus. So if it's something I think kids could watch it, I've got some things later for kids that might be a little bit better. But I think it's just fantastic because you can just watch it very quickly and get a very good understanding of what it is, how it's transmitted, that kind of thing. So I encourage you. I only have one video for what coronavirus is, but I think, again, I don't think you need 20 different videos. So what are some of the symptoms? Again, fever, cough, shortness of breath. And again, with allergies, some people have asthma. So again, call your doctor. Some things you can do to stop the spread. Again, all these handouts are on the wonderful CDC site. They've got a media library, and all these things you can share on your Facebook page, or you can put, on your website, or if you have a library guide or research guide, or a city page, you can put all of these things on there, and you'll see a lot of libraries and city pages, government have used these slides, have used this media repeatedly, and I think it's great. It's simple, it's colorful, it gets the message out. So again, avoid contact with people that are at risk. Cover your cough. Um, don't touch your face. For a lot of us that's hard. But just wash your hands, spray down things. Stay home when you're sick and wash your hands with soap and water. They say that's really one of the best things that you can do. Um, so that's just a little bit about it. Some of the terminology you may have seen in the news or in articles. And again, these are things I thought I knew what they were, but I wanted to look them up again and make sure. So social distancing, and some people are actually voluntarily doing social distancing. They're, teleworking from home. Um, they've closed schools and libraries. People are taking online classes, or you're visiting on a device. You've canceled a large meeting. But social distancing is deliberately increasing the physical space between people to avoid spreading illness. And so some people have, done it voluntary. Some people are worried about that they may have, they've contacted it, so they're kind of social distancing themselves. Self quarantine is a little bit different. This means you've actually been exposed, but you're not showing symptoms. So you want to stay home for 14 days to determine whether you're going to become ill or not. And you want to separate yourself if you're with family, stay in a separate room, use separate towels, pursue good hygiene, different things like that. Isolation is just what it sounds like. It's when you've got confirmed COVID-19 or you're showing symptoms, and so you're going to isolate yourself from other people. Another term you'll see is flattening the curve, and this is kind of a very simplified version of it. The CDC, it's from the CDC. I've seen some really complicated drawings of this. When you flatten the curve, you're basically using protective practices to slow the rate of COVID-19. So what you do is you do these things like social distancing, self-quarantine, isolation. And what that does is because you're doing these things, you're doing these protective measures, you're reducing the impact on the healthcare system capacity. So if you look at Italy, unfortunately, they did not do a lot of things. And so they're kind of in the red here without protective measures. And so they kind of overwhelm the health system capacity. And I'm hoping that in the US, that we can, with these protective measures, we're doing the best we can. It's going to get worse before it gets better. But if we do these protective measures, I think we'll have a shot at trying, to mediate this virus. Just do the best we can. And every person can help flatten the curve if they follow the CDC guidelines. Um, you can't prevent everything, but if you do your best to do that, you definitely can help with the not overwhelming the healthcare system. Okay, so those are just some terms with COVID-19. And if we can definitely share the facts, this is a great handout from the CDC, because there is a lot of misinformation out there and people are talking amongst themselves and not knowing what the facts are. And so it's some of the things I've already said, but people have these misconceptions. The virus is not going to attack you just because you're Italian. It doesn't matter about race or ethnicity. It can hit anybody. Um, and for most people, it's thought that the risk is thought to be low. Um, and people who do isolate do not pose a risk of infection to other people. And there's some simple things you can do to be healthy, and we've kind of talked about those already. But I think it bears repeating. Don't touch your face, stay at home when you're sick, cough, cover your mouth, cough when you cough, wash your hands with soap for at least 20 seconds, and then know the symptoms. Knowing the facts can help with panic. It can help flatten the curve. It can ease your mind if you know the facts. That's the one thing that I feel like I have control over, which is finding the facts, sorting through them, and verifying what I find. That's one of the things I feel like I have control over, and we'll talk more about that in a little bit. So I don't know if you just saw this, but President Trump put out guidelines. These are kind of similar to the CDC, but he's advocating 15 days to slow the spread. And it could be that it ends up being longer. We don't know yet. The numbers are still coming in, and so we're just going to have to wait and see. But he's got some things that he's specified. And with that, one of the things I wanted to look for, and that throughout I have cited some articles. The links are there; they're working. So if you need to come back to this, you can look at the links. So unlike what you've seen at the grocery store, if you are preparing for a self quarantine, really the experts say that you only need about 14 days supply per person. And I think a lot of people were stockpiling. And one of the things I found out from the FDA is that we are not running out of food. It may look like it, we have low supplies, but the FDA said there's no disruption of the food. We're not going to run out of food if that's one of people's fears. And that's, again, misinformation, psychology, whatever you want to call it. But if you look at the FDA website, they've got all kinds of frequently asked questions about this, and we're not going to run out of food. Um, so that's one of the things. And the other thing they advocate is also having comfort food. So if you love chocolate or ice cream, have a little bit on the side, coffee. Some people, their comfort food is wine, or, so make sure you have those things for about 14 days. Other home essentials like toilet paper, paper towels, diapers, feminine protection, all those things, think about those. Also, you want to have at least a 30-day supply of your medicine. I have yet to find a Walgreens or CVS that's closed to get my medicine, and you can go through the drive-through. So, I think that that's not something to worry about. But also your non prescriptions, things like, Mucinex or your allergy medicine that's over the counter. Make sure you have those. They advocate having a first aid kit. The other thing people are worried about is the water. We have plenty of water. Tap water is great. Some people don't like tap water, but our water supply is fine. So if necessary, buy bottled water. But we're in a situation in this country where most places have decent water. Have copies of your health and medical records just in case. Make sure you have things to entertain you. Things like, of course, we've got the plethora of things on the internet where you can watch a million webinars or great courses in history or whatever. But also think about non-screen time, things like board games or, doing exercise. You also want to have a plan for your pets. Do you have enough dog food for them? And, what happens if they get sick? I recently had to take my dog to the vet, and they had some security measures in place for social distancing and, one person in the room at the time. So it varies based on your vet. And then also, if you're like me, you have older parents. What's your plan for family care for your older parents or people who have medical conditions? What's your plan? So have that in place. And if you don't have these things in place, it's okay. Just start thinking about what you're going to do. So here's this is as of last night, the numbers. And this, again, this can make you feel panicked and overwhelmed, but we're going to put that in perspective. So this is confirmed in the world. This is through Johns Hopkins Medical University. It's a dashboard that they've put together. Um, so you can see the total deaths in the world, the total recovered. And if you look at those statistics, again, we don't have any recovery statistics for the United States because it takes about a month to get those numbers. But if you look at it, things are turning around worldwide. It may not feel that way, but sometimes looking at the numbers helps you put things in perspective. If you look at the US statistics, this was as of last night. This is updated, I believe, in the morning, so it may have changed a little bit. And I'm going to show you, again, another place you can go to get the absolute latest. But this is taking statistics from the CDC, from the World Health Organization. You can see down at the bottom, they've got all their data sources. The next thing I want to show you is specific to Florida because I know that that's probably the most important to you in terms of where you live and your counties. So I'm going to share my screen because I want to show you how interactive this is. Again, this was as of last night, and you can see the different counties, which is what I really like about this. So Florida's taken some of that information and kind of made their own dashboard, and this is from the Florida Department of Health. So give me a second. I want to share my screen because I just want to show you how this is interactive. So just one second. And there might be just a second of lag, so I apologize for that. And it might take a second for this to come up. But what I like about what Florida did, I know the numbers aren't really great in terms of looking at something, but the thing that I like about this is over here on the right-hand side, you can see the number of cases. But if you actually click on a county one time, cases, who is in and out of Florida, and the age range of the cases, and it just kind of gives you more of a background on it. Um, so it tells you who's been hospitalized and if it's travel related or not. So I think that's just good information to have. Again, the more facts you have, the more you know, the more you can put things in perspective. Collier County. Oh, I'm so bad about the county, Susan. Is it near? Oh, maybe I can go down here and click on it. Collier. Okay, there we go. I see it. Do you guys see it now? It's on the screen for Collier County. And they are constantly updating it twice a day, so you can kind of see the numbers. And although it's not great, again, the facts are going to help you decide, things that you need to do for yourself, things for your family. Again, so I just wanted to actually show that to you. The next thing I'm going to do, since I'm already here, is I want to show you again. The maps are great, but you can also go to the World Health Organization and the CDC. There's a little bit of lag here. I was trying to highlight these on my list here. And also the CDC and the World Health Organization. So let me just show you those really quickly. And again, these are sites that I trust. So this is the World Health Organization, then they have a situation report. I would also encourage you to visit the World Health Organization. Again, they've got a ton of media resources. They've got a ton of advice for the public. So there's handouts, there's things, they're not written with jargon, they're easy to understand. Situation report. So you can see, again, it's got the numbers. It does it by region. And it talks about things that are happening. And again, it gives you a map. I think the other map is easier to read. But again, it gives you some data here that you can look at. Again, they've got some fantastic, simply written information that you can look at for schools, for older adults, resources for the community. And then they've also got a situation summary you can click on. They've got a map. Again, you can click on your state and you can get information. And this is actually taking us to the Florida Department of Health, where they've got the dashboard that I showed you. Okay, let me switch back to the PowerPoint. Give me just a second, I'll be back there. Okay, so that's just, again, some information about coronavirus, where you can get the latest updates so you have the facts. So this is what's overwhelming to me and personally and professionally and for my family and for my friends. If you have a second and you feel like you're willing to share, type in the chat box, what fears do you have about coronavirus? A logical, I'm going to share my fears with you, and they don't have to be logical. That's okay. You're allowed to feel what you feel. So if you have a second, type in, what are you afraid of with this virus? And we got lots of people talking. Yeah, irrational behavior. Bring it home to your family. Mass hysteria, absolutely, Cheryl. Yes, working. Okay, economic collapse. Yes. Treatment options for people who are infected, absolutely. Yeah, not knowing if you have it or not. And they are developing things as we speak. Um, and so I think we're going to get there. So I'll just share. So you guys keep typing because everybody else is seeing this too, and it may make them feel like they're not as, you're not alone. So my fear is that, this is John Candy from Vacation, um, National, sorry, yeah, Vacation. And it's that, the world is closed. Everything's shut down, which it is, a lot of it is shut down, but there's still things you can do in your life. That we're going to run out of food. And like I told you earlier, the FDA says that's not going to happen. Of course, Walking Dead, we're going to be walking around like a bunch of zombies. Like I said, I didn't say my fears were logical. And how to care for my family. Am I going to end up in the hospital? Are they going to have enough resources? So thank you for sharing. Exactly. How do you care for aging parents who don't live with you? My parents are in their 70s and they're in decent health. My mom has some underlying conditions, so they're not coming out. They're in for the duration. So here's some things you can do to deal with your fears. One of the first days, my grandson, this is my grandson in this picture, made me think about this is that he's stopping to smell the flowers. Now it's not a real flower, but it's the same to him. And it's having gratitude for what you do have. And I know that that's hard sometimes when you feel overwhelmed. So, what are some of the things that you can do to deal with this? You can stay away from up to the minute social media news. You can limit your time. I've done that. I don't have the news on all day long because a lot of times the news will present the worst case scenario. And so you don't always get a total picture because there are good things happening in terms of vaccines. And I mean, you don't always get that full picture. And sometimes the news is still in it to make money. So if you limit your time, that may help you. For me, huge. Knowing the facts, right? Knowing how to determine what's real, what's not, what's a hoax. What are the trusted sites? And I'll summarize those for you in a minute. Knowing the facts, like we said, reassure yourself with the facts. Create a new routine. Go outside. Go for a walk. You know, uh, Hobbies. We talked a little bit about that. They don't have to be screen time hobbies. Play the piano. Get lost in a book. Right. Um, that's what started my whole career. Play a board game. And Anita, your dad, does he have any technology? Because what about, calling him or texting him or doing a video chat? They've got some free services right now where you can, do FaceTime or you can do the Messenger that has a chat window. You can chat. There may be something you can do with that. And if you have severe anxiety, I mean, this is overwhelming to a lot of people. Think about getting help, speaking to a professional. And I'm going to show you later a website you can go to that's free. You don't have to leave your house. Oh, fantastic, Anita. So I would, once or twice a week, try to call him and get him online. I really like this quote. There's a ton of information out there. The challenge is trying to determine which information is accurate. And so what I would suggest is finding a few, just a limited few sources that you trust and stick with them. Again, limit the frequency of your update. Know when to walk away. I'm a news junkie, right? So I'm trying. This is hard for me, but you don't have to know every single detail every single minute. So practice a little self-discipline. I'm doing that. You can uninstall apps on your phone, or again, limit your time. Think outside of yourself. Think about ways you can help others. I'm a key spouse for the civil engineering squadron at the base. So if somebody needed groceries, I could take that to them. Or, things like this, host webinars for people. You don't have to be there in person. Things like that. How can you help others? Don't forget about yourself. In this time, self-care is really important. You want to make sure that you're sleeping, that you're eating, that you're taking care of yourself. You're getting exercise. Your things like meditation, which I'm not very good at, but things that you can do to pay attention to your basic needs, and don't feel guilty or chastise yourself about worrying because you're entitled to the way that you feel. Your feelings are valid. But again, think about this, and the key is to work towards understanding your fears and putting them in context so they don't keep you from living your life. That's my self-help talk. I'm not a psychologist. These are just things I think that would help most people. So I want to take a quick second, literally like 1 minute. If you have a sheet of paper, if you don't, that's okay. Just you can type it in the chat box. Um, my husband has said this to me the entire time we've been married when I get overwhelmed or stressed about things. He says, focus on what you can control. Again, limit your exposure to social media and news sources. But what I want you to do, if you have a scratch sheet of paper, draw a line down the middle. And this is the exercise you can do later if you don't want to do it right now. You can do it with your family. But draw a line down the middle, and on one side, write things I can control, and on the other side, things I can't control. Okay? So for me, I can't control the spread of the virus. I can't control how other people feel and their rationality. What can I control? I can control the facts. I can control who comes into my house. So think about things like that. And if you have a second, type it in the chat box. But this is just kind of a very quick self-help exercise. You don't have to do a lot. And I think it just can help ease your mind. And if not, I've got a phone number that you can call. It's free. And so let me show that to you. So this is a disaster distress helpline. And it helps with people that have feelings of stress during this time. You can also connect to their website. You can talk with them through text. So it's just a number that's out there that can definitely help you. Okay, so not that I am downplaying the importance and the severity of this virus, but I think, again, it's all about perspective and knowing the facts and easing your mind. And so this is the article that I saw. There's a couple more out there, again, about reasons not to panic. And so, again, just trying to put a perspective on this in these kind of times where you're feeling overwhelmed. So we know what the virus is, right? It took a couple years to identify the HIV virus was associated with AIDS, but we've had notification of the let's see that they identified the genome that was responsible for coronavirus by January 7th. So we know what it is. We have a test to detect it since January 13th. The situation is improving in China. That control and isolation is paying off, and the number of cases, if you look at the numbers, are decreasing. So we are going to get there eventually. 80% of the cases are mild. I know it doesn't seem that way, but for a lot of people it's mild. However, 14% do get severe pneumonia, and 5% it's critical or fatal. But for most people it's mild. People are recovering. If you look at the numbers from China, you'll see that the numbers are going down. There are more people being recovered. The symptoms appeared mild in children. It's 3% in people under 20, and mortality under 40 is 0.2%. So I'm not in that category, but that's very great news. The virus can be wiped clean. It's with alcohol. Again, hand washing is very important. Science is on it globally. There have been a plethora of medical evidence articles, about 184 since this started. So people are writing about it, people are studying it, people are researching it. There are already 8 projects seeking vaccines, and there are 80 clinical trials underway testing antiviral trials. So again, it's thinking about perspective, thinking about what you can do to not panic. And let me just be clear. I'm not trying to downplay the virus. I just want to have a little sense of optimism. But again, we have to remain vigilant. And I love this quote from Martin Luther King. This quote stands the test of time. Today, our very survival depends on our ability to stay awake, to adjust to new ideas, to remain vigilant, and to face the challenge of change. Now, he was talking about something different, but I think it applies to the virus as well. Yes, Angela, diluted bleach or water. I forget the ratio. I think it's a fourth of a cup of bleach to a gallon of water. Please correct me if I'm wrong, somebody. We had that in a spray bottle. So if you ran out of, wipes, you couldn't get them from the store. If you Google and look for a good source, if you Google, it's going to tell you the exact ratio. But again, we have to remain vigilant. Everybody needs to do their part, but I still think there's room for optimism. Okay, so these are some of the sites that again, I've got very few because I don't want to overwhelm people. And I also think that these government sites are great. And if you want to go back and look at them, of course, Florida Department of Health and sometimes the county and city health departments' websites are really good. Google has a setup of information and resources. I didn't show that to you, but it points to all the government sites. It's actually very good. And I think Google must have partnered with the government a bit because whenever you do a search for coronavirus, immediately anything that you do is going to come back with all the CDC sites. So I think that that was a fantastic partnership. Also in Facebook, they've got an information center right when you log in every time that you pull up your feed. It's right there. It's the latest information. Okay, so what I want to do is I want to switch and show you a couple of the hoaxes that are out there. I'm not going to go into every site here, but this is probably one of the most famous, and it's called Snopes. And I'm going to share my screen with you again very quickly, but they have a whole center of categories for the different hoaxes for coronavirus. So let me share my screen with you real quick. I will be right back. Okay, so I'm just going to share a couple of these with you, but I wanted to show you the categories and kind of what Snopes does. Again, this is kind of an automated response. They have checked the facts for us, which is fantastic. So if you had only had one place to go and check everything, I would suggest Snopes. So here's the categories coming up. So in terms of conspiracy theories and predictions, U.S. government response, these are all the fact checks that they have done separated by category. So one of the things I'm going to look at is, let me just pick one category, prevention and treatment, okay? And what they do is they take, let me scroll this up so you can see it. It's taking a second to come up. Sorry about that. Okay. So this is a whole section on prevention and treatments. And it's going to catch up in a second. So, will sipping water every 15 minutes prevent a coronavirus infection? False. And then what they do is they actually, if you click on the article itself, hopefully this will come up, it's going to give you a second as soon as it loads. A little bit slow here. Here's the claim, here's the rating, and then they actually give you the article and the origin of the article. And then they kind of fact check it for you and give you some reasoning behind it, and then they also show you their sources. So a ton of information here. I'm going to go back and share my slides. I want to show you a couple other places you can go. Give me just a second. Okay. Exactly, Rachel. It does not hurt to be hydrated. I agree. Definitely. Self-care, take care of yourself. Okay, the next one I'm going to talk to you about is all sides. So this takes kind of the facts about the facts about the political side of the issue, not so much a hoax, but kind of puts it in perspective from the different perspectives from the left, from the center, from the right, and takes an article and looks at that. So it's called All Sides. The next one is called Fact Check. Again, another site that checks facts. They've got a coronavirus coverage one down here, although they're featuring all that on their website. The World Health Organization. This is just about 4 different myth busters. This is the site you can go to. They've got graphics you can download, so you could just post one of these like every day if you wanted to. And can you guys still hear me? Oh, okay. Looked like Deb froze for a second. Sorry. So these are different facts. For instance, like taking a hot bath does not prevent the new coronavirus disease. Antibiotics are not effective. And so this is all from the World Health Organization. It's got some good colors and good information, very simply stated. So they've got, I think it was about 30 or 40 Mythbusters, so you might want to check that out. PolitiFact is another source, and they use some different categories here, like false, mostly false. They have a pants on fire category, so liar, liar, pants on fire is kind of what they're saying. For instance, this Facebook post on COVID, there is no COVID-19 virus. And so what they do is pretty cool. For instance, if they explain the whole article, the facts in it that are wrong, different things like that, but they also have a little category that says, if you don't have a lot of time, if the time is short, here's the basic facts about this article and why it's wrong, right here in the center. And they also give you the credentials of the people that are doing the fact checking. So it tells you, this is pretty small, but it tells you who's doing the fact checking and their credentials. NewsGuard is a new one. I just found this, but what they're doing is they're putting together all the websites that publish false information. So that's something that you can look at. Pointner, again, is another website that posts things that are false or misleading in the news about the coronavirus. And you'll see that they're posting things fact-checked by AFP. Again, some of the hoaxes or misleading news here are, anti-malaria drug is a cure for COVID-19, and they're saying that that's misleading. So it goes into why and different reasons like that. But you'll notice that it uses AFP and one of their sources there. So this is the AFP fact check, and I had actually heard this on the news and thought, oh, okay, that's nice. You can just gargle, and that's going to help, vinegar, salt. Thinking, oh, okay, well, that's kind of like disinfecting, that might actually work. No, it doesn't work. Has anybody else heard this on the news about, gargling? Now, if your throat's sore, it's definitely going to help your throat, right? But it's not going to going to kill the coronavirus. So, and it tells you where it was posted and gives you all kinds of information. So these are some of the fact-checking sites here that we kind of went through quickly. Okay, my slide just kind of, okay, there we go. My slide didn't appear for a second. So we've got all these great automated resources that we can send our patrons to, we can look at ourselves. However, not every single fact out there is going to be in Snopes or Fact Check or whatever. So we need to think like a detective, like Hemingway says, and I inserted librarian here. And every librarian should have a built-in automatic crap detector operating inside him. We're all detectives. So that's the best strategy you could take about information that's in the news about coronavirus. There's some terminology here, verification versus fact-checking, and I'll show you a little bit more about that. But verification is more associated with journalism, and it's also what we do, really, right? We verify the facts. It's a scientific-like approach to getting the facts and also the right facts. And fact-checking is a specific application of verification, and so it's like a fundamental practice that enables fact-checking. So if we don't have automated services, what do we do? There's also fake news. This has been the latest thing that librarians have had to address, although we've addressed fake news and fake resources our entire careers. But oftentimes they're sensational. Sometimes they're used to generate revenue. It's false, counterfeit, could be fake. And some of the first uses of fake news popped up in at least 1890. Sometimes they're spread as a joke or a satire, to influence political views. So those are, some things about fake news and some sites here that you can look at. But it's nothing new. I mean, even in the times of Octavian and Mark Antony, there was fake news. He did a whole media smear campaign, and we know what happened there. Things in World War II, they had propaganda. The Orson Welles War of the Worlds, radio program that sounded true. So again, having those skills are fantastic to be able to determine what's real and what's not. And again, like I said, controlling the facts is one way that you can manage that. These are some terms that you'll need to know that you'll see with coronavirus. Hoax, misinformation, satire, clickbait. These are all terms that talk to getting you to click on something and it's not true. That's the summary here. Filter bubble is something you want to think about because sometimes people go and look for news that already supports their views. Um, Nothing against Fox News, but my parents watch Fox News and they don't watch any other programming to kind of temper that. And so that kind of, that's their filter bubble. They like to see that kind of news. And so that's not a criticism. It's just how they like things. And we like things the way we like them. And so, um, thinking about looking at other resources to balance out your views is very important. So why us? Why is it important that we are the ones to help fight for this correct information? If you type in the chat box, that would be fantastic. And as you're typing, I'm just going to kind of talk about it. This is nothing new for us. This coronavirus, digital resources, it's no different than any other information we evaluate. And I'm going to give you 5 strategies that you can use very quickly for that. We can build collections and programming that focus on media literacy. We're advocates for skepticism. We know we can provide access to our patrons for a variety of information, classes, and we can help patrons re-examine how they approach digital truth, especially now with the coronavirus. When we're closed, there's still things that we can do. And just got 2 slides. This kind of hits home about why we should look at this digital truth. 89% of people either get news from news websites, apps, or social media. That's where they're getting their news. People don't often read the newspaper anymore. So that's where they're getting their news. And if they don't have the skills to differentiate what's true and what's not, that's a problem. And about 1 in 4 people report sharing fake news, whether they're aware of it or not. And the thing about the gargling, your dentist shared it, right? So I mean, it's out there, and so educating people on how to determine what's right and what's not, and it's important. I mean, we deserve the truth. You post things that aren't true. I mean, your dentist said that, and you know now that it's not true. Not to criticize your dentist, but you know, credibility sometimes comes into play, right? It can hurt a lot of people. If people, I think there was a news story just last night about these people who heard about that they were testing this specific medicine and they found it on their shelf in the garage or something and they took it and one person died. Now I need to go back and verify the story, but people are not, sifting through the news and getting the right information. And the truth can benefit you. I mean, if you have the facts, you know what to do to prevent coronavirus, you know what to do to help yourself and others. And also, there's this study, students, they don't know how to, they have trouble finding credibility online as well. So that's why it's important for us. That's why we need to serve as that role. So I'm going to give you like 5 strategies very quickly because I want to get to some resources that are going to help you. This is from the International Federation of Library Associations and Institutions. A lot of the techniques are pretty much the same. Consider the source, read the whole headline, check the author's credibility. Do they have any kind of record? Also look at supporting resources. See if it's a joke. Look at your own biases and ask experts. And this is one more geared towards kids. So the same kinds of measures that you can look at. The CRAP worksheet, this actually has you score based on currency, relevance, authority, accuracy, and purpose. And then this is kind of a little bit different, verifying sources and emergencies. You know, get the facts, learn the basics of the disease, be wary of claims, verify images and videos. There's a lot of them out there that are fake. Double check the numbers. I kind of trust the John Hopkins. I feel like they're really looking at the sources who provide the numbers. Again, be aware of attempts to downplay or, on the other hand, amplify the disease. It will get politicized, definitely. Don't share treatments without consulting official sources, or try treatments, right? And look for what's still unknown. And this verification handbook is a really good place to look. So where can you get help? What are the good news sites? This is a media bias chart, and they've done a ton of research, weighted, done different measures. But if you look at the top, in the mainstream, um, these are kind of and I'm going to click on it so you can see kind of what it looks like. But these are the sources that are doing fact reporting. They're neutral or balanced bias. And so you see there's a few things here in this top box, but there's also a few things in the bottom. And so when I look at the news, these are places I go to. Washington Post and New York Times can be a little uh, skewed towards political, but it still provides some of the facts. But again, all this being said, you still have to look at the article level. So these are the places I go to for the news. The Washington Post, the Time Magazine, they also have newsletters. You can sign up to get daily information, and that might be one way that you can limit your news intake. Okay, really quickly, I want to talk about strategies for checking websites other than what we just talked about. There's a couple of sources where you can put the URL in, and it'll tell you who owns it. And if you've got like 50 different name servers, you can tell that that's not something that's really great. As opposed to CNN, you can see that this is a real website. Checking on people. I posted that taking a bath can help with the coronavirus in Twitter. I've got expert medical advice. So you need to look and make sure that this person is real. And there's places you can go to do that. I'm going to show you some very quickly. WebMe, and this is outside of Google. WebMe, PQ, White Pages, LinkedIn. I'm going to just kind of show these to you really quickly. If you look at these, you can verify that the person is real. And then also LinkedIn, even without an account, this is me, it will give you a ton of information about people. So you can check to see if they're real. The other thing you can look at is people fake weather and location, and especially in terms of coronavirus, they can fake things just by using fake pictures. And so these are two things that I pretended to post. And you can see that this is a snowstorm and that I have a view of the mountains in Wetumpka, Alabama. So you can probably guess what's true and what's not. These are two places you can go. The Weather Underground has a history, and you can also look at Google Earth. So the one about the snowstorm, where I had to spend the night in the library, that was true. This is the history from Weather Underground. You can see there's precipitation here. Me having mountain view in Wetumpka, Google Earth, no. And you can see that that's not true. You can also check images and videos. I'm going to run through a couple of quick sites. You can look at Google Reverse Image, TinyEye, Veracity. These are all sites that will check pictures. And then Amnesty International YouTube Data Viewer will actually check videos. So you can put the image in. It'll tell you where the original image came from. Veracity does that, Google Reverse Image. And then what I like about TinyEye is you can sort by oldest. So you can see that this picture of Michelle Obama actually first came from BBC, and it did not say anything about immigrant jobs. So you can verify pictures. So you can do this with coronavirus as well. And then this YouTube data viewer will break the video down into specific reverse image searches that you can do. So you can see that there is no bear in this video. So real quick, based on some of the things we looked at, what might you do if you got this post from a doctor on Facebook who's talking about the coronavirus? What are some checks that you might do? And just go ahead and type that in the chat box. And as you do that, I want to move to These are some training sites. I'm not going to go through them, but there's some sites you can go to get help with media literacy and fake news. Yes, he published your peer-reviewed journals. Perfect. First thing I might do is take his picture and reverse image search. And if you do, you will see that that's a stock photo of a lonely man in church. So again, here's some more training sites and resources. So very quickly, I just want to walk you through some of the sites that you can look at for helping you prepare, you as libraries specifically, not our patrons, but you as libraries. There's a guide to COVID-19 for public libraries. There's a pandemic preparedness from the American Library Association. And what I've done here is I've provided sites that are hubs. So each one of these sites is going to have a lot of information that you can go back and look at. Library Journal has, again, a hub of articles and things that they're posting about it. There's a library disaster planning and community resiliency guidebook. So you can look in that and you can plan for a disaster response if you haven't already. It's got policy documents that you can reuse. There's also a PLA resources on COVID-19. It provides information to public library members. And again, they've compiled information for your library community to respond. This COVID-19 for Oregon and Massachusetts is fantastic. It talks about different ways you can respond, not just for the disease, but also about programming, how to offer remote services. So these were two really good examples of what libraries did for libraries in their state and librarians in their state and how to prepare. Couple more articles. There's some questions you can ask about whether to stay open or closed. And then I started following which Florida libraries were closed, and I started on a list. But I think it might be better if people in Florida posted to this list because it's got all the libraries in the United States so far, people who have contributed to it. It's crowdsourced about the libraries that are closed and what their status is. Like they're closed, but the technical staff is there. They're closed completely. So it might be fantastic for you to add your library to that so people know. There's a bunch of Facebook groups that you can become a member of, and this is going to help you stay connected. There's two that I want to mention that you may not know about, libraries and social media. So they're talking about library and social medias in general, but also during these times, how you can use social media to still be connected with your patrons. And then Sanity Matters at Activities and Advice. This is a great group for activities. And also, another one I wanted to show you, I'll get to in just a second, has got even more. So this is more about helping libraries prepare. There's some resources for how to help academic and school libraries prepare, how to teach online, how to provide information to databases and copyright in terms of this time period, how to teach online for schools. There's also some information for school personnel from the Department of Education. What I did want to mention, and I was hoping I'd have time to show this to you, but please look at it afterwards, is the amazing educational resources. So this is a list. Swiftland posted it on their Facebook page, but it's got a ton of resources on things that companies are providing for free. And they also have a Facebook group, and they're constantly posting things that are available for free, activities, ways to learn, different things like that. There's also a post by two high school librarians in School Library Journal and things that they've done, how they've made their plans. And then here's some resources to talk to kids about coronavirus. This first one is a comic that kids can print out and fold and read. This is an article about how to talk to your kids about coronavirus. There's a cute video, brain pop video. It really helps. And then one of the things that they're offering to teachers for free is Zoom. So you can actually, if your school system or your library even doesn't have access to teleconferencing, this is one way you can do that. Also Facebook Live, different things like that. And then these are all just information guides that you could steal, borrow, and put up on your website. These are examples that, if you do want to put something on your blog or your website, these are things that you could look to get examples for. So it's basically putting out information. LibGuides Community, if you click on this, you can do a search for coronavirus, and you can limit by type of library, public, government, hospital, and you can get examples of how they've posted their information and do something similar. So you don't have to reinvent the wheel about putting out information on coronavirus on your library website or blog. These are just some more information guide examples. And then some more information guide examples. One of the things I wanted to talk to you, basically I have about 1 minute, is how to still provide services. And this is one thing that I didn't see a lot of. I saw a lot of, here's information about coronavirus, go to the CDC, here's information about, how to get testing, here's how to make sure you don't have it. But I didn't see a lot of libraries still continuing to offer services. I saw some. And so even though we're closed, we still need to market our services. There's still things that we can do. For instance, this library in, I believe it's Colorado, they're offering streaming story time. You can use your Facebook Live. You can have a YouTube channel. That's free stuff. You just have to reach your users to get them to know about these events. The Florida Electronic Library is always available. We need to push that. It's something that people can get to. So use your social media, your Facebook, your YouTube, your Twitter, to keep communicating with people and the services that you have. You could have a virtual tea. We've got a plethora of resources that we offer remotely during normal times, and we just need to remind people that those things are available. Again, you can do a live webinar with your patrons. So I just want to show you really quickly, basically 3 websites, and then I've got some training and we're done. But I just want to show you 3 websites. I'm just going to share my screen. I understand if you have to leave, but these are 3 libraries in Florida that I think have done a fantastic job of saying, hey, we're still here. And I think it's great to look at examples of that. So again, you don't have to reinvent the wheel. So let me share my screen really quickly, and I will go through them very quickly, I promise, because I know you only have an hour. Okay, so let me show those to you very quickly. So the first one is from an academic library, which is the University of Central Florida. And it's just very simple. You just take what you have and just kind of form it into academic resources during COVID-19 situation. So here's some things, here's how you can access library resources during this time. Very, very simple, right? Another one I want to show you is a public library. And I don't know if there's anybody here from this library system, but the Hillsborough County Public Library Cooperative. Again, very simple image here. Important library information. We're closed. Visit the library from home. Fantastic. And it's got a great image. It's open 24/7 for you. Learning and fun for all ages. I think that's a fantastic job. And the last one I want to show you is kind of a special library. It's a hospital library. This is the Borland Library, a University of Florida. Let me show you. So again, our doors are closed, but our services continue. So I think marketing in this time is important. We're doing the same things that we've always done, but just reminding people, hey, we're still here. Our doors may be closed, but our services, our fun is still here. Okay, I'm going to stop sharing my screen, and I just want to show you, you've come to the Swiftland training, which is fantastic, but I also want to show you, and if somebody could paste in the chat box when I get back there, I've got a list on Google Drive of all the extra training that you can do. Give me just 1 second and I'll get back there. And okay, so those are the 3 Florida libraries. I wanted to focus on Florida so I could show you that you guys are doing a great job. but I think more needs to be done to comfort people that our libraries are still here during this time. There's a couple other libraries that I mentioned just because I also thought they did a really good job. Again, I didn't want to overwhelm you with sources, but the State of Louisiana Library Resources for Young People is a really great example. Okay, so very quickly, there are a ton of training opportunities. This one from the WHO is available all the time. So it's kind of a way to learn about the COVID ID and also for people who are health professionals, decision makers, and the public. And then there's some training that's coming up today, in fact, at 1 o'clock Pacific time that you can look at how colleges should respond. I'm just going to go through these very quickly. How library, implementing books by mail. I don't know if anybody's thought about that here. NLM resources for librarians to assist researchers, because our researchers are still out there, right? We want them to research during this time. Stepping up the needs, serving the needs of the communities in crisis. Not losing our minds and hearts when we most need them. So that's a fantastic self-care one. Public libraries respond. This one I thought was great for parents, school librarians, bringing it home for the win, tips for parents keeping their own students on track and organized on the home front from tutor.com. Librarians respond to coronavirus and other pandemics. These are all upcoming. Frauds and scams, what you need to know. That's one thing I also didn't mention, that these techniques for looking at fake news would also apply to things like frauds and scams. People are taking advantage of this time period, unfortunately. Managing stress and anxiety from Public Libraries Association. Also, innovative solutions in times of crisis. These are all things that might be helpful to you regardless of the type of library. There's also some recorded sessions that you can look at or about to be recorded. These have already happened. And different things about instruction at a distance for college libraries, how to prepare for the unexpected from Circe Dynex, nonprofits. We don't think about special libraries and nonprofits. There's another one from American Libraries about managing stress. And then this one, I love the title. I wish I'd thought about this. Know and Go, Don't Stand So Close to Me, about remote work and spaces and how you continue that with libraries. How to combat misinformation, which is kind of a little bit about what we did today. Copyright, I didn't even think about that as an issue, but copyright, what do you do with that when you have remote issues with articles and things like that? So this file, in case you wanted to go to something that's today or tomorrow, let me see if I don't think I can copy this, but if somebody would put it in the chat. And also you're going to get a copy of this. Moving forward, be skeptical. Trust the facts, but verify. Again, like I said earlier, I'm not trying to downplay this issue, but have some cautious optimism. Use some of the strategies I talked to you about today about fact checking. Use those sites that have done a lot of the work for us. Fact check. Don't just, use your filter bubble. Look at a bunch of different sites when you're looking at news. Not a ton, just a few that are going to help you. Verify as much as you can, and then always share what we know with people, with our patrons. Give them those skills so they can check the news. And so that's my summary is, cautious optimism, know the facts, and don't get overwhelmed. And I think that's one of the ways that we can help ourselves, our patrons, not to panic. And knowing the facts is something that we can definitely control. Thank you very much. I know I went about 8 minutes over. I had a lot more information that I wanted to tell you than time. So if you have any questions at all, please let me know, and I'll stick around.
Thank you, Dr. Rollins, for an informative webinar this morning. Attendees, if you enjoyed this webinar, we ask that you join us on March 30th for Stephanie's next webinar on the coronavirus. To stay tuned for any updates that might change. As always, we encourage you to keep an eye on the Swiftland CE calendar, the Swiftland Facebook page, or your message from the listserv. Thank you everyone for attending and have a great rest of your day.
And